Hello everyone! Let's continue our discussion about the integral components of client care. This time, we will discuss hygiene. At the end of discussion, the students will be able to describe hygienic care that nurses provide to clients, identify factors influencing personal hygiene, enumerate the purposes of bathing, apply the nursing process to common problems related to hygienic care, particularly about the skin, and then explain factors that support safe environment for the client. So, hygiene actually is a science of health and its maintenance. It is actually a highly personal matter determined by individual and cultural practices. Personal hygiene involves care of hair, eyes, ears, perineal genital area, the skin as well. For the hygienic care, okay, the types of hygienic care often described by when they can happen. Example here, we have morning care. So usually in the area, okay, in the hospital, we provide morning care to our clients. So usually after breakfast, where we also assist them in terms of elimination, bath or shower if they are not capable of, perineal care, okay, back massage, oral, nail, and hair care. We also have another type of hygienic care. Okay, so this is hours of sleep or PM care. So it includes elimination, washing face and hands, oral care, back massage. Hygienic care is also done as needed or PRN care, okay, which is actually required by client's need and more frequent bathing or changing of clothes. So here are the factors influencing individual hygienic practices. We have culture. Some cultures face a high value on cleanliness. Okay, they place a high value on cleanliness. Body odor is offensive in some cultures. Okay, so even so, if a body or odor is offensive to some cultures, there are also other cultures that finds it acceptable or it's normal to them. In terms of religion, okay, ceremonial washing are practiced. For the environment, financial capability can influence bathing practices. Okay, for instance, it's the availability of the facilities. Like, for instance, those who are homeless may not have water available. They don't have the facility. They don't have other necessities for bathing. On the other hand, in terms of the developmental level, okay, children actually learn hygiene at home, okay, and the way they do hygienic practices vary according to the individual's age and how they were taught as well by their parents or significant others. So next, you have health and energy. So individuals who are ill may not have the motivation or energy to attend to hygiene. Some clients who have neuromuscular impairments may be unable to perform hygienic care. That's why we need to assist them. And for personal preferences, so here some clients prefer shower or tub bath if available, and if they are, of course, they are allowed by the attending physician. And the time of bathing varies as well. So let's discuss here the skin. The skin protects the underlying tissue. It regulates the body temperature, and it's also the one in charge of secreting sebum. So sebum production, so this is an oily substance that softens and lubricates the hair and skin. It maintains moisture. There's also bactericidal action, and it transmits sensation. So the skin also produces and absorbs a vitamin D. Okay, so we have here the sweat glands or pseudo referus glands, okay? All surfaces except the lips and parts of the genitals. So we have apocrine glands, okay? We have the axillae, anogenital areas, and they actually begin to function at puberty. Eccrine glands are palm of hands, okay, soles of feet, forehead, and this actually cool the body through evaporation. In assessing and diagnosing the skin, okay, part of the assessment and nursing diagnosis you can find here, possible nursing diagnosis. So for the assessment, we take a look at the client's nursing history. So let's determine the client's skincare practices and other self-care abilities. So what can the client do, okay? For example, the client's functionality in terms of participating, any limitations, you have to take note of that. And also the cognitive level, how can they understand your instruction? And also their motivation or the desire to do self-care abilities. Also, you have to check if there's any past or current skin problems. Are there any sensitive presence of like sensitive skin, okay, any allergies, and that will now be more thoroughly found out through the physical assessment. So, given the nurse's findings on the assessment, then the nurse now can proceed to nursing diagnosis. These are just sample statements, not necessarily that complete yet, okay? Because of again, we need a thorough assessment. Examples, we have altered in self-care. So, specifically bathing, if that's the case. Also, dressing, toileting, or feeding. So, that's the particular functionality that you must attend to. So, in doing the planning, the nurse and if appropriate, the client, if the client can participate, or the family, set outcomes for each nursing diagnosis. The nurse now performs the nursing interventions and activities to achieve the client's outcomes. In cases where you are planning for home care, like you have conducted home visit, okay, so here you must plan for the client and family's ability to provide self-care or care, the need for referrals and health services. So this one you are going to facilitate, and also be able to attend to the learning needs. What do the client need to know, okay? And then for evaluation, you have to check, okay, the functional ability for self-care. So, also you check for the efficacy of instructions and assistive devices, its use. What about the client status? Did the client status improve? Is there any need for analgesics? Like, for instance, there has been like pain while doing the procedure. How about the tissue integrity? Should there be skin alteration of skin condition? Okay, so you check the skin tissue integrity. For instance, there's presence of wound. Okay. Nutrition adequate to support skin integrity. You also have to check if the client has sufficient nutritional intake. Okay. Now let's take a look at the hair, okay? So hair assessment is very important. So the hair, okay, your crowning glory as we say, okay, reflects the person's feeling or self-concept, well-being, state of health. Okay, we also have here developmental variations like lanugo, that you can see fine hair on the fine hair on body, fetus, puberty. You can now determine or find out pubic hair, sebaceous glands activation, okay? How about thinning hair in older adults, okay? Or alopecia, loss of hair. For the assessment, just like what we did in the skin, we determine, okay, we read the nursing history. Okay, so there you're going to determine, are there usual hair care practices of the client? How about the capacity of the client or the ability of the client to do self-care? Is there any history of hair or scalp problems? Are there conditions known to affect the hair, like as you assess or check the hair, can you easily find that, oops, there is thinning of hair or even alopecia, hair loss? Is there dandruff? Is there pediculosis capitis? Okay, there's infestation of pediculus humanus capitis on the hair, scalp, okay? And is there hirsutism? So hirsutism, that's, for example, a condition in women that results in excessive growth or dark or coarse hair in male-like pattern. So that is not normal to a woman, okay? So you have to check, okay? If, again, take note of that if it is present. So, how do we do now the implementation? In doing so, we can actually conduct or do brushing and combing hair. This again is needed by the client in order to have, again, prevent any possible tangles in the hair. So the hair needs to be brushed and or combed daily. Long hair may present a problem depending on the condition of the client, especially their capabilities to do so, if they can still care for their hair. Dark-skinned people often have thicker, drier, curlier hair than light-skinned people. Some people may have it straightened or have naturally straight hair. So that's the variation. In shampooing the hair, okay, actually this one is part of your RLE. So let's have a quick look at it. So you need a shower or sink for clients who are able to do this self-care. Okay, but in some instances, in some facilities, there's this called head bath where a shower cap that contains shampoo and conditioner can be placed. In most of the health agencies, okay, just like what we practice, we have a bed shampoo. Okay, so in doing the bed shampoo, the client who has limited capacity to get out of the bed, okay, is being provided with bed shampoo, okay, in the bed. All right. So next, we have beard and mustache care. So, again, this is in relation to what you are supposed to have for demonstration, right? This is most important aspect to keep clean, okay? And grooming about beard and mustache care can be requested. It's again depending on the client, as we have discussed in the RLE. Shaving, okay, again, before doing shaving, you must consider several things like the client's medication. So, take note if the client is taking aspirin or anticoagulants, okay, you must check very, very well if there are any signs of bruises, or also wound, okay, and you must check with the institution if it is required that you must secure an order from the doctor prior to doing shaving because again of the risk of bleeding. There are also drugs that even if they are not anticoagulant can result to bleeding. So what's important is that you check the indication, contraindication of the client's medicines or medications, okay? If preferably, okay, you must or you can use electric shaver because it's um, more more conducive, okay, more actually smooth when you use it to the client, and with proper, of course, with proper procedure, you will prevent bleeding or causing wound to the client. in doing the evaluation of the hair, okay, you must again check the data that you have collected. You must judge whether the desired outcomes have been achieved. If not, then why do you think so? Then again, if it is not met, then you have to modify the care plan. Okay, so we are of course, student nurses together with your clinical instructors, we support a hygienic environment. It should be holistic, okay? The care should be holistic. And it's not just, for example, doing the bed shampoo, but then assuring the client that there's comfort, okay, after the procedure. So also another one is to provide a healing space. Okay, as reiterated by Nightingale, environment plays a significant role in the healing process of the client. So, in doing the bed making, of course, you have to provide clean linens, okay, and make sure that you practice it well, that you don't spread the microorganisms, of course, from one patient to another, or from you to the client, and vice versa. Also, take note of ventilation. So, there should be a proper ventilation of the area. Okay, others can be offensive to people. Some can have irritations like sneezing, okay, coughing, and then also take note of the noise. So, the staff should always, again, keep their voices at a normal level, okay, and usually they communicate along hallways, and then they again must not disturb the clients who are asleep. And also, patients with conditions like in pain, okay, there will be increased perception of pain whenever bothered by the noise. So there you go. That's all about hygiene. All right. So my reference for this one, still we have the fundamentals of nursing. Okay. That's Cogier's. Okay. So thank you for listening, and please also watch the next topic, which will be about yeah, communication process. Okay. See you.